Nursing students, come here. I'm going to teach you the symptoms of the syndrome of antidiuretic hormone and diabetes insipidus in a way that you are never, ever, ever going to forget. I don't know why they don't teach it this way in nursing school. It would make endocrine disorders so much easier. Here's the thing. Syndrome of inappropriate antidiuretic hormone involves antidiuretic hormone, which comes from the posterior pituitary gland. It's a hormone, which is a chemical messenger that travels through blood. Its destination is the renal tubules and the blood vessels. At the renal tubules, it causes the kidneys to retain water. And at the blood vessels, it causes that smooth muscle in the blood vessel walls to constrict, so vasoconstricts. Now that we've gotten that normal A&P out of the way, let's talk about syndrome of inappropriate antidiuretic hormone. That means there's too much antidiuretic hormone, which means that antidiuretic hormone is doing too much of its job. It's retaining too much water in the kidneys. It's causing the blood vessels to constrict too much. What kind of symptoms do you think that's going to cause? Well, for one thing, let's think about the urine. The urine's going to be a lot more concentrated because not as much water is being released. The kidneys is keeping the water. And because it's keeping the water, our fluid volume is going to increase, which is going to possibly cause edema, possibly cause increased blood pressure. Not only that, but don't forget about the vasoconstriction of the blood vessels. If we have more fluid and we're constricting the blood vessels, that's more risk factors for high blood pressure with this syndrome. And what about electrolytes? Because antidiuretic hormone, it tells the kidneys to retain water, but not necessarily to retain sodium. So sodium is still leaving the body at a normal rate, which means that the remaining sodium in the body is being diluted by all this extra water that's sticking around. So we're at risk for hyponatremia right now. Now let's turn to diabetes insipidus, which is the exact opposite of SIADH, syndrome of inappropriate antidiuretic hormone. Diabetes insipidus involves too little antidiuretic hormone, so the symptoms are going to be the exact opposite. Your kidneys are getting rid of too much water, so your urine is going to be very dilute. Your blood pressure, you might expect that to go down, and you might be showing signs of dehydration because you're losing so much water in your urine. And when there's not enough water in the body, that's going to decrease blood pressure. Plus, don't forget about we're not going to have that effect of vasoconstriction because the antidiuretic hormone also constricts blood vessels, but we don't have enough of it. So the blood vessels are staying more relaxed than usual, in addition to not having as much water. That equals the low blood pressure. What about sodium levels? Well, the kidneys are still getting rid of sodium at a normal rate, but they're also getting rid of a lot of extra water that it shouldn't be, which means that the ratio of sodium to water is going to change in the blood, which makes the patient potentially get hypernatremia, more sodium compared to the amount of water. So what do you think? Have you ever heard about this endocrine disorders being studied this way before? And do you think you're ever going to forget these symptoms now, or they just make sense, right? You can use the same study process for yourself, and you can also use it to learn how to predict what you're going to do about it, what the nursing care and how to prioritize nursing care and things like that. Because I just walked you through the first 3 out of 4 steps of the Silver Bullet study system. It's the best and easiest way to study for nursing school. And you can get more information about it and get a free 10-minute overview where I explain all 4 steps in detail if you go to my bio link. Good luck on your nursing school journey, and I hope that endocrine is a little bit easier for you now.